You're juggling it all: work, family, decisions, expectations, 6 hats, maybe more every single day. But behind the scenes, your body is running on stress, and stress left unchecked will lead to illness. I'm Dr. Shami, an integrative family doctor, and this is 6 Hats, the podcast that helps you understand what stress is doing to your body and what you can do about it now. Hello, everyone. Welcome back to the 6 Hats podcast. And I'm really excited to have Dr. Brian Ang join us today. Now, he's an ophthalmologist based here in Melbourne, Australia. He's also a nutritional medicine advocate and founder of Nutravision, which we will get into in today's podcast. Now, through his clinical work, he began connecting the dots between vision, inflammation, aging, micronutrient status, and the brain, and discovered how profoundly nutrition shapes long-term eye and systemic health. Now, today, Dr. Ang shares the story behind Nutravision and why he believes targeted supplementation is the next frontier for protecting the eyes, and how precision nutrition can slow degeneration, support cognition, and optimize well-being as we age. So if you're interested in the intersection of vision, science, integrative medicine, and the future of healthy aging, this episode is a must listen. So welcome, Brian.
Thank you, Shami. I'm so excited to be involved, and I must admit that this is my first podcast.
No way.
I am super excited.
I've seen you on YouTube, Brian. You're good. So I've looked at your videos. You are brilliant. And an inspiration, actually, because I just want to really emphasize the fact that you're a specialist. And in my journey through nutritional medicine, it is few and far between. I can't emphasize how rare it is to see a specialist who actually talks about nutrients, nutrition in disease. And it's so refreshing. It's much needed. And it's just a reminder to our audience that at med school, we're not taught about nutrition. We're not taught about the impact of minerals in health when it's just so vital. I almost, like, so many years in, over 10 years into integrative medicine, I almost think, how could I have practiced like this before once I know all this knowledge? So I'm excited to meet a colleague who thinks alike, Brian. So this is awesome.
This is the same for me as well.
Awesome. So my first question, which kind of leads on to that, is you're a specialist in ophthalmology, which is all the conditions about the eye. So what inspired you to explore nutritional medicine as part of your clinical approach?
Thanks for the question. Actually, Shami, many of my patients have asked me the exact same question. And this is because most of them do not expect that their consultation with an ophthalmologist would somehow involve a discussion about lifestyle factors like stress management, sleep, and nutrition. But actually, my clinical practice hasn't always been like this. And it wasn't because I was trained differently. I was just like my other ophthalmology colleagues. I went to medical school, like you alluded to. I worked my way through the ophthalmology specialist training program, spent years and years learning about medicine and surgery. And of course, I came out of this training very much focused on the medical and surgical treatments of eye disease. All of that changed when my dad was diagnosed with glaucoma, even though his eye pressures were normal. That actually really shook me because he did everything right, but yet he still lost nearly half of his vision from glaucoma. And if that could happen to him, it could happen to me too. So I'm at risk of losing vision from glaucoma. And my kids would be at risk too. And that's when I realized that with conventional medicine, we are so focused on the treatments for eye problems after they've occurred that we neglect the prevention part, the nutrition part, the part where we proactively manage risk to try to prevent problems from occurring in the first place. So I delved deep into the science and research on what we really need to do to keep our eyes healthy, strong, and resilient, to reduce risk to our eyes and vision system, even as we age and even as we abuse our eyes with our screen-heavy, stress-filled modern lifestyles. And you know what? The answer isn't more surgery, isn't more medicine. It's more care, more love, and targeted nutrition. So it's a bit of a long-winded story, but this is how I started integrating nutritional and functional medicine into my clinical practice. And I guess that makes me one of the few eye care professionals in Australia to do so.
Amazing. Oh, I did not realize you've got a personal story attached to that. And often that's the driver because, it's someone that you love. It could be yourself, it could be a family member where you go, there must be another way. And it's really interesting because the patients that come through my door always think there must be another way. And I love that because we've really got to always question the story that we are just following and often following blindly. And that's when we become our own advocate for our own health. And it's so inspiring and so motivating to know that there is another way. There's a whole area in medicine that is not looked at, which is transformational. So let's go into Nutravision. So I know
Yes.
Nutravision is evidence-based formula. So first of all, what exactly is this supplement and how does it improve eye health?
Yes, that's a great question. So, Nutravision is an eye supplement that we developed to provide multimodal and targeted nutritional support, particularly for those who are managing glaucoma, macular degeneration, and troublesome dry eye. So, we looked at the key risks and the key mechanisms that contribute to these conditions developing. And by looking at what we can do to address these from a nutritional perspective, we made sure we got the nutritional ingredients that have been proven in clinical studies to help in these conditions. And by combining them together in one pill, then it makes sure that we cover all the aspects that are important for supporting eye health as we grow older, meaning that there are no nutritional gaps for people who really want to look after their eyes over the long term.
And if you could give me an idea of just a few of what those nutrients are in Nutravision.
Yes, so we've got actually 10 key ingredients here. So we divided into natural botanical extracts and also micronutrients. So some of the micronutrients we've got include vitamin D, methylfolate, methylcobalamin, and also magnesium. And some of the botanical extracts that we've got include saffron, bilberry, and also marigold flower because that's a great source of lutein and zeaxanthin.
Amazing, amazing. I want to sidetrack a bit because
Yes.
you mentioned something so important, which is actually very close to my heart, which I sort of rave on about in every podcast, the impact of stress. And I absolutely love that you mention it. So, what is the impact of stress on eye health?
Yeah, stress is, in my opinion, a very under-recognized risk factor for eye problems. So stress can increase your circulating stress hormone levels. And this, in turn, does a few things. So firstly, it can elevate your eye pressure. And when it elevates your eye pressure, it increases your risk of glaucoma. And I see that in my glaucoma patients because they get stressed, then their eye pressure increases, their blood pressure increases, and that causes their glaucoma to progress. Another thing that we see is this condition called central serous retinopathy. That's when the retina becomes detached at the macula, causing the vision to drop. And that's linked to high stress levels. And of course, dry eyes. When you are stressed, that affects your tear production and increases your issues with dry eyes. So stress, horrible. So super important that we manage stress however possible.
Amazing. And you also mentioned screen time. So I'm curious
Yes.
because this is one of the many questions on my intake form is how many hours do you spend in front of screens? And I look at it from different angles, the impact of blue light on cortisol, on insulin, the fact that you're sedentary for so many hours, but also even posture and how that impacts your health. So how does it impact eye health?
Whoa, where do I start? So screen time or screen overexposure it has such a lot of impacts on eye health but the main ones are digital eye strain. Okay, it sounds very trivial, but digital eye strain can cause a lot of issues. It causes issues with dry eyes, and it makes your ability to function later on when you're not looking at screens, it's affected. Not only that, it also affects your sleep, especially if you spend a lot of time on screens before at nighttime. And when your sleep is impacted, that also has downstream effects on your eye health because when you sleep, that's when your cells get the chance to rest, recover, and repair. It's the same with the eyes. And if you're not sleeping well, then your eye cells aren't going to be able to do that. And there are now studies that have linked poor sleep with glaucoma and macular degeneration. So it's really important that sleep is one of the key things that I always talk to my patients about. And screen time is really bad news for sleep. And finally, I also want to touch on the concern about blue light causing direct radiation damage to the retinal cells. Currently, there are in vitro studies showing that blue light does actively damage the retinal cells. In real life clinical studies, we haven't really been able to demonstrate that yet. But personally speaking, I feel like it's because we haven't been able to measure it appropriately, correctly. So right now, the official position is that too much screen time doesn't cause any damage to the retina, but from my perspective, if we can take steps to reduce this risk, it's about risk reduction. If we can reduce this risk by putting screen or by having healthy screen habits, then why not? Because at the end of the day, you really want your eyes to outlast your heart. And, managing screen time, I feel, is one of the key aspects of it.
That's amazing. And so, what about blue light blockers and putting software to block blue light? Would that be helpful?
Yes. I always recommend my patients to put blue light blockers on their screens, or if they wear glasses, make sure that their glasses have got blue light filters.
Block it. And on a side note, I'm just keeping an eye on the new developments in the world, and there's actually daylight computers coming out. Well, they're out, and it's actually from the States, and it's just literally first year of production, and there's already huge demand, and perhaps that's where we all need to get to.
Yes, perhaps. Yes.
Our eyes. The next question is, I suddenly realized I'm familiar with the terms glaucoma and macular degeneration, but in simple terms for our listeners, what is glaucoma? What is macular degeneration?
Yeah. So glaucoma is a condition where the pressure in the eye is too high, and that causes direct damage to the optic nerve, which is the nerve that transmits information from the eye to the brain. So to be able to see, you need a healthy functioning optic nerve. When your eye pressure is high, it damages the optic nerve, so the ability to transmit information is lost. And in fact, glaucoma is the commonest cause of irreversible vision loss worldwide. So it is something that's really important that we should always go to the optometrist to check your eyes. Macular degeneration is a condition where the macula, which is the central part of the retina, the most sensitive part of the retina, the part that is responsible for sharp, clear, detailed vision. When you grow older, that part just degenerates and the cells no longer work as well as they should because of the high metabolic demands. And when that happens, you start to lose your vision. And guess what? Age-related macular degeneration is the second commonest cause of irreversible blindness worldwide. So again, this is another condition that you need to make sure you're screened for when you go and see your optometrist for your routine eye checks.
Amazing. So what can our listeners do to just almost be aware of what are the early signs that they, apart from having regular eye tests and regular eye checks, what else can we be aware of in terms of early signs of disease?
Yeah, so specifically with glaucoma and macular degeneration, it's a little bit hard to really feel the symptoms. And often you only feel the symptoms when the disease is too far gone, it's a bit too late to do anything. So the most important thing is to be aware of your risk. Because when you're aware of your risk, then you can take steps to reduce that risk. So for glaucoma and macular degeneration, the key risks are, number one, family history of glaucoma or macular degeneration. So if you have a family history, then you just go and get your eyes tested a lot more regularly. And the second thing would be certain lifestyle habits that increase your risk of both conditions. I'm referring to smoking and alcohol. So these two are actually really bad for eye health. And I know people talk about safe limits for alcohol, but in terms of eye health, they've now discovered that there isn't any safe limits. So the less you drink, the less risk there is to your eyes.
Amazing. So yeah, it really is a check then. You wouldn't really know if the eye pressures are going up. Or
With macular degeneration, there is another thing called the Amsler grid. I don't know if you've seen it before. It's a grid with vertical and horizontal lines, and you look at it, and if you see that the lines look wavy or there are patches missing, then that could be an early sign of macular degeneration. So that's something that I give to all my patients, especially people who are over the age of 65, so that they can monitor their vision at home.
And what's the impact of poor sugar control and diabetes with glaucoma and macular degeneration? Is that another risk factor?
Yes. Diabetes is a risk factor for macular degeneration and glaucoma. So portion control, again, very important.
Amazing. Now, before we let you go, this has been so inspiring, Brian. You mentioned about stress and lifestyle changes. How do you manage that in your life?
Well, I sometimes feel like I dish out advice that I should really listen to myself.
So the ophthalmologist,
So actually 3 things that I tell my patients to manage stress, and I try to follow that myself. So the first is with regards to the breathing technique, so deep breathing. And the technique that I use is where you take 5 seconds to breathe in and 5 seconds to breathe out, and you do that a few times a day. And in fact, it's also evidence-based. There has been a clinical study that shows that doing this deep breathing technique helps to reduce your circulating cortisol levels, reduce your blood pressure levels, and also reduce eye pressure. So it helps for people with glaucoma. So that's the first thing. And the second thing that I learned is about trying to clear things from your mind at night before you go to bed. And the way I do it is that I take a piece of paper and a pen, I jot down everything that sort of bothers me and what I need to do. So that way, after I list everything down, I give permission to my brain to say, hey, you don't need to think about it anymore. You can go and sleep because the next day, my problems are still there. So the reason that I write it down is so that I don't forget any of my problems. So that way, I give permission to my brain to switch off. And the last thing is about giving myself or allocating time to myself. And this is actually crucial because I often, when I take time to do something that I enjoy doing, I actually feel guilty about it. It's about giving permission again to yourself to, hey, this hour is for you, for yourself to do what you enjoy doing, as long as it's not screen related. And then just it could be going to the gym, meditating, whatever. So these are the 3 things that I tell my patients to do, and I'm trying very hard to do it myself.
Amazing. Thank you so much for your time today, Brian. And this is going to be super helpful for so many of our listeners. And I just checked, actually, that this podcast is now in 78 countries around the world.
Wow.
It's phenomenal, because I really want to get this message out there to as many people that their problems, there is a solution. We need to keep looking for solutions.
Yes. Yeah, I think this is a really important message. And I have to say, I have to take my hat off to you, Shami, for doing this for so long now. And I've counted, like, you've done over 100 episodes. That's amazing.
Thank you. Do you know what? It keeps me going. I always learn so much. It's actually the fun part of my week. So this is awesome. Thank you so much, Brian.
You're very welcome. Thank you.
Thanks for listening to 6 Hats, where it's all about progress, not perfection. If this episode spoke to you, don't wait, hit follow now, leave a quick review, and share it with someone who needs to hear it. Want to take your next step today? Download my ebook. The link is waiting in the show notes. And remember, this is general advice only. Always speak to your practitioner for anything medical. See you next time.